name is Jerome Hsiang, and I'm the chairman of the Young Professionals program of the Los Angeles World Affairs Council and Town Hall. I would like to welcome everyone to our session today about the future and the promise of telemedicine. Our speaker today is Jamey Edwards, co-founder and CEO of Cloudbreak Health. Cloudbreak is leading the way in a particularly important part of telemedicine, which is language translation and user access. And after all, how can doctors actually provide the best care to patients if they can't even communicate coherently with them? And as we will discuss later on in this discussion today, this is a particularly relevant question to ask as telemedicine goes global.
I'm here.
Okay, great. Hi, Jamey. Jamey, why don't you get us started by giving everyone an overview of what Cloudbreak does and your view of the state of telemedicine today?
Sure. Cloudbreak Health is a unified telemedicine company, and what that means is all the services that we provide can be combined onto a single platform. The company initially started off doing language interpretation services in healthcare, and it was delivered over a telemedicine factor. So a patient presents who's limited English proficient or deaf and hard of hearing at a facility around the country, and the doctor notices they don't speak the same language, and communication is the #1 diagnostic tool that a patient has, and the #1 engagement tool and empowerment tool that a patient has. So sorry, it's the #1 diagnosis tool that a provider has. And so as a result, without that communication, what happens? You end up in situations where the doctor can't speed care to the patient, they can't communicate. It's an absolutely terrifying experience for the patient. Imagine being in an emergency room and people are racing around you and putting needles in your arms, and you have no concept of what's happening to you at that point in time. So our goal is to reduce that fear, and the mission of the company is to humanize healthcare, and we do that by allowing patients and providers to communicate their stories to each other. And that's a key part of what drives diagnosis. Over time, the company's expanded to 1,200 hospitals across the country. We do this over 85,000 times a month in terms of number of encounters. So that makes us one of the largest telemedicine companies in the country. And we've expanded the services on the platform to not just solve this major healthcare disparity, which is what to do with a limited English proficient or deaf and hard of hearing patient and how you level the playing field for them, but we've actually started to do telestroke and telepsychiatry. And recently with COVID and the acceleration of telemedicine, we've launched and pioneered a new use case called telequarantine, which allows our hospitals to treat a patient from outside the room and reduce the need on PPE and mitigate the risk of infection for our frontline healthcare workers.
Okay, so one of the things that you've just mentioned is that it seems like the company actually has two very distinct challenges. One is how to communicate effectively or provide the translation, provide the services. The other is the technology side. How do we get thousands upon thousands of hospitals with tens of thousands of pieces of equipment to actually work together at the same time? So I guess my question here is, and you would obviously know much more about this than anyone else in this room, but how does one solve that challenge? Because I think as telemedicine, as we talk about the promise and scaling telemedicine up, how does that challenge get solved in a bigger and bigger scope?
Yeah, well, if you take a look at health systems across the country, telemedicine 1.0, which has, by the way, been around for a long time, was pick up the phone, call your doc. And the telephone is, for all intents and purposes, one of the most interoperable vehicles around there. When telemedicine 2.0 came along, that was the addition of video, it was the addition of email and chat and all these different types of functionality. All of a sudden, interoperability became an issue, and none of these systems would talk to each other. And a lot of the early grants in telemedicine were on a department by department basis. So imagine that cardiology makes a different technology decision than radiology, who makes a different technology decision than the ER, who makes a different technology decision than labor and delivery, and it goes on and on and on and on. And so our goal was to create an interoperable platform that actually could be the glue that pulls all these disparate services together so that a doctor can have one experience and a patient can have one experience, but access all the different specialties that they need on a single device and single platform. And it's important, you know, as life has gotten more complicated in technology, there's Android, there's iPhone, there's PC, there's all, you know, the Windows, all sorts of different ways that you can access telemedicine services these days. And so when you're looking at the evolution of the space, we've really started to make the movement from single use case types of technologies to technologies that are more platform oriented, that can be integrated using APIs, that can be integrated using SDKs, so that you can create this seamless experience no matter what the technology is. And so our platform, as an example, integrates natively with VidYO, Cisco, Skype for Business, Polycom. We recently announced Zoom, and we're actually doing integrations into the different EMRs like Cerner and Epic as well. So the key is to take more of this platform approach instead of a single use case approach or a point solution approach, if you will, and to be able to drive value for the entire care team and basically surround a patient with that care team, not only from a single health system, but it could be from multiple health systems. Imagine a patient who has multiple comorbidities or multiple issues. They might have congestive heart failure, they might have diabetes, and they might be dealing with COVID. Well, what's the right care team who's got that special set of skills to handle that specific patient's issues? Telemedicine enables that to happen because you can actually amass providers from a multitude of different health systems across the country in different locations, or even internationally, as the case may be.
So I think that's really interesting that you brought that up, because one of the interesting things about a lot of these very complex sort of communication systems and networks is that at a certain point you start to see perhaps some sort of emergent properties coming about. People, different nodes, different doctors, perhaps behaving in ways that they would not have if they were more siloed off or before all this is available. So have you, in your experience, have you, and if you have, like, could you let us know a little bit about like some of these things that you're starting to see, like some of the ways of collaboration that just was not possible in the past?
Yeah, I mean, it's been pretty staggering, and again, COVID has been the ultimate telemedicine and collaboration accelerator in my view, because one, we've never seen the world so aligned in fighting a single enemy, and a level of collaboration that's not only happening within our nation, within our nation's hospitals, and between companies that were once competitive, but has seen this collaboration happen throughout the world. I mean, if we think about it, Jerome, it's pretty staggering. We've shut down the world's economy in order to try and attack the current COVID solution. And what we're witnessing are hospitals who previously were competitors with each other collaborating around specific use cases, or if one hospital has a center of excellence in infectious disease, sharing that center of excellence with other hospitals in their surrounding communities, or even across the nation, or even internationally. We've seen Cleveland Clinic and Mayo and different folks like that, have built up their international operations in China and Abu Dhabi and all sorts of different areas. So we're seeing unprecedented collaboration right now, and we're also seeing the unprecedented innovation that's resulted as effect of this COVID catalyst. Hospitals realize they have a problem that they need to solve now, and I think the interesting thing about the current situation that we're in is we're looking right now to roll these platforms out as quickly as possible, get them in the hands of physicians to attack this current problem. But what we're seeing is the telemedicine genie, if you will, is out of the lamp, right? And as a result, putting it back in, I think, is going to be a problem. A lot of people are building a lot of muscle memory around the fact that telemedicine can simply be that great first line of defense for healthcare and can help us, reduce costs, speed speed care to places where you feel most comfortable, which is your home and possibly your workplace, create a better more satisfying experience for the patient and provider alike. And I think that post-COVID, we're going to see that a lot of these visits where healthcare really stressed that in-person visit, that touch and that feel, we're going to see those things move digitally, and this is going to really accelerate the digital transformation of healthcare worldwide.
And how are the patients responding to this? I mean, obviously
Yeah.
the COVID thing is very recent, but in sort of the recent past, are they taking this up sort of willingly, or because I just actually looked at an article talking about how Japan is starting to move in that Japan is one of the most technologically advanced societies in the
Yep.
world, and yet it's not necessarily accepting telemedicine as quickly as maybe some people have thought they would, but it's starting to happen. So how is it from the patient's perspective?
Yeah, so interestingly enough, there's kind of two facets to telemedicine. There's the B2B part of telemedicine, which is our nation's healthcare systems sharing providers where there are provided shortages or beaming an interpreter to the point of care. And then there's the B2C part of telemedicine, which is a consumer requesting or a patient requesting a visit in their home or wherever they are at that given point in time. It could be on the side of a mountain as long as they've got cell phone access or satellite access. So I think the interesting thing to note is that people largely felt adoption in the B2C market was really lagging for many years versus B2B. Telestroke, telepsychiatry, and those types of services have been used in hospitals for the last 10 years very effectively to help save lives, speed care, and help take care of healthcare disparities. But the consumer market has lagged, and I think a lot of that was because one, we stressed an in-person visit. We wanted to go in to see, as patients, we wanted to go into the urgent care, and we felt like that concept of touch was really important. And let me say, the concept of touch is still truly really important, but there are new telemedicine tools that can help a patient avoid some of the things that they don't like: waiting times, traveling to and from the appointment, and they can still receive, the studies have shown, you can still receive the same quality of care in a telemedicine environment that you can in an in-person environment for these low acuity type of use cases. No matter what, you're never going to get rid of, the emergency department or urgent care when you need that physician intervention for something like putting in an IV or something of that nature. But most of the low acuity use cases that end up in those care venues don't need to be there. And so what we're seeing now is patients realizing that there's convenience, that it's cost effective. They can access it anywhere, anytime, any device. And those types of things have really helped, drive the adoption of the technology. If you speak to companies like American Well or MD Live, their volumes are 5 to 6 times normal levels of where they currently, where they always have been. And so this adoption is now happening faster than ever. And I think patients are, post coming out of this COVID experience, going to realize that telemedicine has its place in the daily practice of care and how they're going to access healthcare going forward.
So I wanted to pivot a little bit towards the more international side of things.
Yeah.
And I think one of the promises that we've been hearing about for so many years of telemedicine is the ability to serve very underserved areas of the world in terms of medical care. One particular challenge is, of course, access to technology to begin with, and also the infrastructure, and whether it's a landline or literally or satellite links or whatnot. Are you seeing are you optimistic about that problem being solvable so that we have reliable links, reliable technology and whatnot, or do you think that is something that is going to be a problem for a while?
Yeah, it's a great question. So one of the things that we look at when we analyze healthcare disparities, both nationally and internationally, is broadband access. It is a key indicator of someone's quality of life, is whether or not they have access to the internet and access to communicate in a timely fashion with people who they may need. And so this concept of what's the broadband access, you'll actually see in third world countries that sometimes their cellular infrastructure is more up to date and more advanced than even sometimes what we see in the United States as we start to move to 5G here in the US. And because a lot of what we have done in the US was we had hard lines, we were working on DSL or MPLS lines or whatever private path broadband connectivity we had. All of our houses had to be wired, and we were looking at those different things. But with the advent of Wi-Fi and cellular, we're starting to see third world countries almost, take a leap that they couldn't have taken before if you had to dig trenches and put fiber in the ground. So as a result, we're seeing that a lot of these third world countries now can have access to the great technologies that are available in first world countries, whether that be telemedicine or even things like Zipline, which gives the ability in remote Africa to have blood samples delivered by drone and vaccines delivered by drone and doing those types of things as well. Babylon internationally has done a lot of work in some of those third world nations in terms of bringing telemedicine consults to them. And so we're seeing the world get smaller by virtue of our connectivity with one another, and technology is the big driver of that.
So I think that makes a lot of sense, and obviously everyone's talking about 5G connectivity at this point and how this could revolutionize just about everything that everyone ever touched or anything like that.
Right, right.
But I think so. So one of the things I wanted to talk about, and not to be a downer or anything, but I wanted to talk a little bit about some of the challenges that this field is going to run into. So why don't we talk about regulatory issues. So as telemedicine gets global, or even in the United States, right? Different states have different regulations about all sorts of things. How do we harmonize this issue? Like, because the EU is going to have one set of regulations about a lot of stuff. Then China is going to eventually, and then the United States. And if we're going to do telemedicine on a truly global level, how do we get people to play nicely with each other?
Absolutely a key issue. The UK and EU has something called GDPR, which are their kind of equivalent of our HIPAA. Canada has something different. Each country has taken its own stance when it comes to privacy and security, and navigating those things is absolutely a labyrinth, and it's treacherous, and you've got to make sure you're doing it right. And sometimes what it means is the cloud is our solution. You're able to stand up an instance of your service in that country, subject to that country's rules. And previously, before the cloud, that type of thing wasn't possible because you'd actually have to go put physical infrastructure into that country. So I think the cloud is going to be one of those solutions. I think here in the United States, not only did we have HIPAA and privacy, but we had physician licensing that was done on a state-by-state basis. And what we've seen is the administration say, look, while COVID is happening, physicians can now practice across state lines without any regulatory hurdles. By the way, we've kind of thrown HIPAA to a certain degree out the window, not fully, so that we can actually reduce the friction associated with getting people to collaborate and fixing a lot of the regulatory infrastructure that's in place. And again, I think those are things that are difficult to put back in the bottle once people have gotten used to them, and we've shown it actually works really well. So I have a feeling that here in the United States, the regulation is going to start taking a little bit of a different form. And as we try and make sure that we're, protecting patients' privacy, a lot of that is going to go more to, good security, and how we're handling that versus, regulations per se. At some point, that regulation, technical debt, if you will, is going to have to get rationalized and harmonized, to your point. Internationally, again, that's going to be a more difficult issue. Right now, a lot of nations have simply waived those types of regulations, but what we might see is more of like a UN-driven telemedicine policy or pronouncement or act that people can get behind and sign on to, that, or a compact that would allow us to practice across nations in the same way that we're now practicing across states. We hold out a lot of hope in the telemedicine industry that nothing's going to create more friction, but that being able to access the provider you need gets more frictionless as a result.
Okay. So I have one last question before we turn it over to the Q&A session, and it's going to be, I guess, it's going to be a kind of a fun one. But I think a lot of people have this view about telemedicine where they see the robots doing surgery from a different country, or controlled by a doctor in a different country. That kind of stuff is flashy, and obviously the stuff of science fiction. But so my question is, that gets a lot of people like me very, very optimistic, very sort of, wow, this is it, let's go for it. Would you say this is the kind of sales pitch people should be making? Because I think my question is really about whether or not the public has a certain perception of what telemedicine is versus the hard work of actually making the optimism a reality.
Yeah, well, look, I think there has never been a time where we should be more optimistic than we currently are with kind of how technology can help facilitate better care and improve our lives and do those types of things. And Jerome, there's two types of technology, right? There's exponential technologies, and those are things like 3D printing, artificial intelligence, and those types of technologies. And then you've got the more incremental technologies that we've already been using, but when you assemble them in a specific way, they can actually get the job done. And I refer to those more as, evolutionary technologies. So, but they can be revolutionary in their own right, depending on how they've been assembled. And so we know that email is a proven technology. We know that chat is a proven technology. We know video and audio are mostly proven technologies at this point in, our history. And so assembling those in a really practical way, I mean, that's happening now. That is technology of today. We're seeing, millions and millions of telemedicine encounters across our country, let alone the world, where there's probably hundreds of millions of them occurring. And if you take a look at someone like Kaiser Permanente as a result, that health system now performs more of their services over telemedicine than they do in person. right? So let that sink in for a second. They're doing more telemedicine than they're doing in-person visits as it stands. And so I think that to me makes me insanely optimistic that given the right market dynamics, every health system can be doing that. Kaiser and the VA, the Veterans Administration too, is doing more telemedicine visits than they're doing in-person visits today. And that's saved, the government, a ton of money, and it saved patients a ton of hassle and created, again, a more satisfying experience on both sides of the equation. So I think there's never been a more time to be excited, never a time to be more excited, let me rephrase that, to be more excited about what's happening with technology today in healthcare and what the future might hold. And as some of these exponential technologies start to become more mainstream, artificial intelligence is being used to review films for COVID today and take a look at MRIs of the lung and to be able to identify the issues where something like pneumonia looks very different than what COVID looks like. And if you take a look internationally, Ping An and Alibaba both have developed AI tools to do this, and it actually properly diagnoses the patient 96% of the time. So I think we're going to see a lot more of these technologies that we thought were far-fetched, or as you said, sci-fi, becoming more commonplace. And it's, for me, really, really exciting times.
Okay, great. So Jessica is going to join us now and read some of the questions that have been submitted by the audience. If you have a question for Jamey, please click on the question section on your control panel and send it to us. We'll try to get to as many of them as we can. So Jessica, I will turn it over to you now.
Great, thank you, Jerome. Jamey, so one of our first questions is, what about insurers? Are they willing to pay for telemedicine now?
Great question. So when it comes to the payer market, what we've seen is that payers for the last few years have included telemedicine as a benefit. It wasn't a benefit that was broadly adopted by their members, but obviously that's changing now with the technology acceleration we've seen in the last few months. And so, yes, insurers are absolutely paying for it. We're seeing it as a workers' compensation benefit. We're seeing employers who say telemedicine now needs to become one of the required benefits that an insurer is providing if they're going to work with company A through Z. So yeah, absolutely, it's a big part of the insurance market, is providing the service, because insurers and payers have realized it is a less expensive, more cost-effective way to speed timely care to the patient, and it avoids those hospital visits, which can be really, really expensive and an unnecessary piece of the puzzle for that patient if all they had was the flu and the prescription for that flu was going to be like, have some chicken soup, we can prescribe you this medication, whatever it might be. So all of that stuff can really happen over telemed. And what the payers are also doing is for people who have really chronic issues, things like diabetes, things like CHF, they're actually sending them home with remote patient monitoring tools, pulse oximeters, blood pressure cuffs, all those different types of things, of Bluetooth enabled, diabetes measuring toolkits, so that all that stuff can happen remotely and you don't need to come into the office to do those things anymore. So those types of advancements have really meant that this has become part of how insurance now will do business and provide care going forward.
Yeah, there's kind of a similar question to that. And you answered it a little bit, but this person said that usually when they go into a physician's office, they have their temperature taken, they have their blood pressure taken. Is that something that's still kind of done through the telemedicine portal, or how is that going to be done in the future?
Those are all things that can be done with Bluetooth enabled devices that can be issued to you by your insurer, or you can even go out and buy at the store. I mean, God, it's amazing to me today what even the Apple Watch can do. And all these different, fitness trackers. I wear one called the Whoop, and it tracks your sleep, it tracks your heart rate, it tracks all of these different things that can be shared with your provider. So not only can we be more conscious about what we're doing on a daily basis, but all of this data, and by the way, we're just in the early innings of this. We've been tracking this data for a long time, for the last few years, and still sometimes patients, we don't know what to do with it, and it's a lot of data, and we can't identify if our heart beat had raced up, or all those different types of things. So from a big data standpoint and an artificial intelligence standpoint, now providers of these services are now tracking these types of things, and they're creating alerts so they can actually notify a patient and say, we'd like to come in, or we'd like to launch a telemedicine visit, or what it might be. So we're going to see these types of devices become more and more prevalent in our lives as lifestyle devices, but also as healthcare tools.
Right. Someone asked, if I'm experiencing stroke symptoms, say outdoors, describe the process and how I'm connected to a healthcare professional.
So what would most likely happen in a stroke situation is you would end up going onto that app on your phone and dialing in to see a provider. That provider, if he felt like you were having any type of stroke or heart attack or anything like that, is going to call 911. That is, if you're in any type of life-threatening situation or you feel like you're having that type of issue, 911 is always still your best bet. And while you're on that 911 call and that ambulance is on its way, a doctor can be helping walk you through what you should be doing to help relieve some of your symptoms and stay safe while you're in that waiting period. And then what happens is once you get into the ambulance can connect you with the hospital to where you're going. And so when it comes to stroke, there's something called door to needle times, which is basically the point in time in which they can actually issue you something called TPA, which are thrombolytics, which help, they're the clot busting drug. And so what you want to do is speed the time to that. And so all telemedicine is doing in that scenario is speeding the time that it takes so that when you show up at the hospital, they can get you that drug as soon as possible. So if they've already done your assessment pre-hospital in the ambulance or while you're sitting there in the park, then by the time you get to the hospital, they can then say, great, now it's time to push the drug, as opposed to spending the 5, 10, 20 minutes that it might take to work you up while you're there. So think of telemedicine as the enabler there. And then hospitals, if they don't have a neurologist on site, can have that neurologist beam in and do the evaluation while they're at the hospital and make that decision to push TPA or not push TPA. It's all about the fact that time is brain and making sure that we can maintain as much of that functionality as possible by speeding the door to needle time.
Great. Among industrialized countries, where is telemedicine popular?
Telemedicine is actually popular in most industrialized countries. If you take a look at China or the UK or anywhere throughout Europe, Canada and the US, I think the amazing thing to me is that it's actually having accelerated adoption in non-industrialized countries, again, due to the fact that we brought up before, like before things were based on broadband access and your access to having a high-speed connection. And now that high-speed connection can really be delivered over cellular. And so a lot of these services have been optimized for that. So you're getting people in remote villages in Africa accessing telemedicine now, where before that wasn't possible. But most industrialized countries have integrated telemedicine into their care pathways in some way. And while that was in the works for a long time, this current situation that we're in with sheltering at home and different cities on lockdown, here in LA, ensuring that people have access to care, those types of things are definitely accelerating the adoption of telemedicine in those venues too.
Great. Can you tell us a bit more about your over-the-phone interpreting services? Translation can include cultural nuance. Are your translators Indigenous speakers who are tuned into this important part of translating? And how are you connected to native speakers or interpreters?
Yeah, so bringing an interpreter to the point of care has always been a core of what we've done at Cloudbreak. And I think the key part of it is understanding that our interpreters, we take a lot of pride in their training and a lot of pride in their qualifications. A lot of these interpreters are first generation people who moved to this country and were doctors and pharmacists where they were before, but they haven't been able to secure a license here in the United States. So they turn to find other careers, and medical interpreting is one of them. Our interpreters are certified medical interpreters. The majority of them are based in US language centers. They're W-2 employees of ours. And so as a result, we have a lot of control over their training and how they deliver that. And we have a lot of quality assurance that we have in place to make sure that that interpretation is the highest bar possible when it comes to quality. As you can imagine, 70% of communication is nonverbal. And so we really stress video as being something that sits at the center of cost, quality, and efficiency when we talk to our hospital clients. But sometimes that audio interpretation is really all that's needed. And because the phone is so ubiquitous, it's more accessible sometimes than video is. And so we train our interpreters to ask the proper qualifying questions. They're trained in all the different specialties from pediatrics to labor and delivery. They have literally weekly support groups if they've come out of a tough interpretation where something on the other line, resulted in, a very tough circumstance, or they're just receiving training on what the proper way to interpret X, Y, and Z are. We currently have over 50 languages that we offer in video, 250 in audio. And so the goal is to make sure that that language barrier isn't present in our healthcare system, and bringing that interpreter in is the key part to ensure that the the patient feels empowered to take control of their care, and the provider can make that proper diagnosis and mitigate the amount of time that that patient actually spends in the healthcare system.
Thank you. Is telemedicine changing how doctors are trained? Will this affect medical school or other parts of the doctor supply side?
I really hope so. Currently, I'm not aware of very many medical schools who offer a telemedicine as part of their curriculum. In the same way that they hadn't offered to doctors, here's how you manage your practice or a business side of medicine. The medical curriculum as it stands today has been largely focused on how you treat that patient. I undoubtedly have had different schools reach out to us and say, hey, can you come in and do a seminar on, telemedicine and what our doctors need to know? And we're going to see a lot more training on what we call webside manner instead of bedside manner, which is teaching doctors, not only how to communicate with a patient effectively and have good video presence, but now how to do remote exams, which is a much different discipline than doing one in person, where someone else is your hands on the other side of the screen. And that might be the patient, it might be a nurse, it might be a case manager, whoever it might be a home health worker, and being able to guide them to do the exam that you need, and then learning how to decipher a patient's sounds or moans or what they're saying, and being able to effectively do that with the home caregiver as well. So I think training is definitely going to be a big piece of this puzzle moving forward. It's a very adept question, and we're looking forward to helping collaborate with the nation's medical schools in order to do that.
Thank you. Are there any doctors or healthcare groups that are offering any of these services on a pro bono basis for those who are uninsured or perhaps homeless?
There are services that are out there. I can't name one off the top of my head, but if someone wants to follow up with me afterwards, I can definitely find out. A lot of healthcare systems are currently offering any COVID-related consults for free. And they've also, I know of many health care systems that have reduced their normal telemedicine fee from $69 to $29 or $20. So the answer is it depends on the specific situation. We can certainly help compile a list for folks that are interested. And I know that I want to say Kaiser Permanente, as an example, was offering some telemedicine services for the homeless as well. Our platform, we announced that for any COVID-related consults, we would be doing that for free while the COVID pandemic was happening. And I think a lot of different companies have rallied to that. But when it comes to specific medical groups, I think you've got Kaiser and a few others locally that are providing those services.
Thank you. With stroke medicine as an example, if assessment for a stroke event is completed during the ambulance ride to the hospital, can the medication be administered in the ambulance to save valuable time?
That is not currently part of the protocol. They really want the medication to be administered, by a physician. And so those physicians usually aren't in the unit itself, or most paramedic units. Now, they do have mobile stroke units that have been created, which allow that to happen. But in most cases, that drug needs to be pushed in facility and not in ambulance. That being said, that very well might be evolving and changing. As I said, we have these mobile stroke units now, where that can be part of the protocol, but it's on a case-by-case basis with each health system.
Thank you. How is telemedicine working with seniors or people who may be less familiar with technology, but would benefit the most from having access to them?
Yeah, I think the thing that's really neat is that when you took a look at what people would outline as the challenges of telemedicine before, people are like, well, what are our older populations going to do? I can tell you that, my mom and my mother-in-law both know how to use their iPad, and it's very intuitive. So I think the key to making telemedicine work in those populations is not to create a new workflow for the patient or a new interface for them, but to use the tools they already know how to use, their iPad, maybe the remote control on their TV. We've done some work where we've integrated telemedicine onto the cable box and onto the TV, kind of smart TV web OS, so that people could launch telemedicine calls directly using their remote controls. I think it's those types of innovations that will help ensure that our geriatric population has access to telemed, and at the very least their caregiver will, as people become unable to use their technology. And in most cases, like my mother-in-law will sometimes do, I'll get that call that says, hey, how do I use X, Y, and Z app? And the younger generation's always there to help their elders out and provide IT support when necessary. But I think a lot of that question needs to come with better user interface design and with actually targeting tools to that segment of the population so that they can already use what they already know how to use in terms of accessing care and making it as easy and frictionless as possible.
Thank you again. One question regarding psychological treatment or psychotherapy. I mean, what if someone is reaching out where it's not a telemedicine issue per se in terms of a physical health issue, but something that's going on that they need help in that regard?
Yeah, so mental and behavioral health is one of the most significant use cases for telemedicine. We have many clients who have set up, group therapy sessions or one-on-one sessions with their patients. They have mental health hotlines so that they can speak to someone in a rapid way if there are issues. Mental health is one of these mediums that's actually perfectly suited for telemedicine. And in fact, it's been used in hospitals across the country to do assessments for very many years. When a patient who is that a physician fears may harm themselves or in a situation like that is in a hospital, they put them on what's called a 5150 hold, and they won't release them until they've had a psychiatric evaluation. Well, in many hospitals across the country, that psychiatric evaluation is currently provided in telemedicine. And I think one of the other interesting things is when we talk about mental health, one of the biggest things that mental health patients feel is isolation. And having access to video calls actually helps them mitigate that isolation and feel more connected to people. So that can, for the patients in COVID, who are in COVID quarantine today, having access to FaceTime and Zoom or even our platform can help deliver on helping reduce the isolation associated, and those feelings of loneliness associated with their circumstances. So mental health to me is going to be one of the biggest uses of telemedicine going forward.
Thank you. And this will be our final question. Is there any process to follow up with patients who reached out to their doctor and didn't follow up just to ensure their safety?
Yeah, so there are absolutely apps that can be prescribed where you can ask your patient to download them, and then doctors can check in with them via their app, and that can be for post-surgery follow-up, and could be simple post-COVID follow-up, whatever it might be. And we're also working on with some different companies right now, actually putting monitoring tools in the home so that again, the heartbeat can be heard. Different eye exams can be done, et cetera, et cetera, et cetera. So there's all sorts of devices that patients can have in their home that can help them. If a doctor is fearful that a patient hasn't responded, someone can always be deployed to the home from a home health agency. You can't force someone to use the technology that's in front of them. They have to pick up the call per se. So from that perspective, I think there's always the best system is always going to be one that isn't solely telemedicine, but that combines the best methodologies into one cohesive workflow or patient care flow that makes sure that you're dotting your I's and crossing your T's and surrounding a patient with their care team.
Great, thank you, Jerome. I will turn it back over to you.
Okay, thank you, Jessica. I thought that those were like some very, very great questions. So Jamey, thank you very much for sharing your insights with us today about telemedicine and the future of the field. We know that it's a tremendously promising and actually very, very complex area that I think surprisingly a lot of people don't know nearly enough about. And it's obviously a very stressful time for everyone when it comes to healthcare. So it's really great to have an opportunity to talk about the future of healthcare outside of the current pandemic. So thank you very much for your time today. And I guess normally I would ask everyone to applaud, but this doesn't work that way. So thank you, Jamey, again, and
Thank you.
hope to see everyone again at our event next time.